As a critical care or oncology pediatric nurse, it is an unfortunate aspect of the job to lose patients. This can lead to large amounts of grief, unhealthy coping mechanisms, and potentially burnout. It is crucial that nurses have diverse tools to use when experiencing these circumstances. One method of handling this grief can be through the use of coping mechanisms, such as meditation, exercise, hobbies, mindfulness techniques, and associated educational training. Other methods include debriefing after stressful situations and simulation exercises. By implementing these techniques, nurses may be able to maintain positive relationships, sustain optimism, and understand that the loss of a patient is out of their control, allowing for increased coping and decreased amounts of uncontrolled grief. Due to the prevalence of these situations in our upcoming areas of work, we chose to further investigate how coping strategies may impact nursing grief within a 6-month span. Furthermore, we each chose a specific area of interest within pediatrics, such as the neonatal intensive care unit, the pediatric intensive care unit, and pediatric oncology.
Our group decided to do our research on pediatric nurses and how they deal with grief when it comes to losing a patient. Although there are many reported coping mechanisms used, there is no specific research done on how nurses deal with losing a pediatric patient and their self-reported coping mechanisms. With that being said, our proposed PICO question is, in pediatric nurses experiencing the death of a patient, how does the use of self-reported coping mechanisms, compared to not using coping mechanisms, affect nurses' grief response 6 months following employment? The research was broken down into 3 different units. Cameron focused on the neonatal intensive care unit, Kaylin focused on the pediatric intensive care unit, and I focused on the pediatric oncology unit. Each unit deals with a different age group, which helps enhance our PICO question to figure out how nurses on each of these units deal with the loss of a patient and how they cope with that situation.
After researching and analyzing data in the NICU, PICU, and pediatric oncology nursing departments, we found that simulations were created for nursing students to experience simulations regarding neonatal death, and this study showed that the simulations helped future NICU nurses improve their therapeutic communication skills and develop coping mechanisms to handle deaths of their pediatric patients. Another study in the NICU found that more education and studies need to be conducted to find coping mechanisms to help NICU nurses grieve the loss of their patients. In the pediatric ICU, a study showed that a 5-minute mindfulness intervention consisted of music relaxation techniques and meditation help nurses cope with the loss of their PICU patients. The mindfulness-based intervention showed a reduction in PICU nursing burnout cases. Another study showed that PICU team discussions and SWOT center rounds with nurses, techs, providers, and patients, along with their parents, helped everyone in the PICU cope when the impending loss occurred in the PICU. The study also showed that taking a break away from the unit immediately after a loss and socializing with PICU staff members outside of the hospital also helped reduce the nursing burnout in the PICU. Another study regarding the PICU showed that collegial camaraderie and support from staff members helps nurses during their grieving process. In the pediatric oncology unit, a study was found that understanding the concept of resilience is important to educate pediatric oncology nurses to help them grieve the loss of their patients. Another study showed that pediatric oncology staff support is significantly lower than in other pediatric nursing specialties. This leads to the nursing burnout in the pediatric oncology unit and provides a method that proves that more studies will be needed to be completed to develop coping mechanisms to help nurses grieve after a loss of their pediatric patient in the oncology department. Overall, pediatric oncology support from fellow nurses is important to develop a pediatric-wide hospital support system to be able to grieve the loss of the pediatric patients in every department. The graph to the right describes how unmanaged nursing grief leads to physiological and psychosocial symptoms which lead to nursing burnout. The implications from the research are found that nurses would benefit from increased education, coursework, simulations in nursing school, and early in their employment in the pediatric nursing field. The studies show that the death of the pediatric patients and coping mechanisms that would help the nurses grieve after the death of their patients would reduce nursing burnout in this particular field. Hospitals should implement policies for pediatric nurses such as the NICU simulations, PICU mindfulness interventions, and pediatric oncology nursing support systems. Overall, more nursing research needs to be analyzed and conducted to answer our chosen PICO question and to develop more coping mechanisms for pediatric nurses to help grieve the loss of their pediatric patients.